Everybody, this is Dr. Minh here. Welcome back to another episode here at Excelsior Orthodontics. Today, we're going to be taking a look at a before, middle, and after treatment case of a nice phase 1 early treatment. Stay tuned. If you don't know me already, my name is Dr. Minh. I am an orthodontist in Purcellville, Virginia, where we have our own practice. And we really love taking care of all of our patients. And we look forward to sharing a number of cases with you guys and explaining as much transparency as possible about the benefits of different treatment forms, goals, smile aesthetics. If you don't already, be sure to click the like button and subscribe. Before we get rocking and rolling on today's case, we have our episode has been brought to you by none other than Case Co. That's right. If you are looking for a custom home, a custom business, luxury custom home in particular, look none other than Case Co. Casey, Sam, and Aaron are three brothers and best friends that are more than happy to take care of you guys. They will walk you through the entire process. You're going to get a project manager. You're going to get your on-the-ground supervisor that walks you through the day-to-day activities, keeping you transparent, up to date. If you want a beautiful, lovely mansion, or if you want like a nice little boutique condo, or perhaps if you want a beautiful, luxury, modern style orthodontic office, they did design and build mine. Yes, look no further than Case Co. They are your guys. Oh, they managed to not only gift me this awesome trucker hat. I think I might have said this, but they managed to also gift me this really cool hard hat. This thing is awesome. I should really just, whenever I hang up picture frames, I should just wear this and make it feel like I'm doing some lumberjack drywall place and work right here. What a cool hard hat. This thing is awesome. What a cool gift, man. Thank you, Casey, Sam, and Aaron. This is so cool. Okay, anyway, on to today's episode. Let's take a look here. Today, we're going to be taking a look at an expansion face mask appliance. Now, what is that? We're going to walk you right through it. Not to worry. This is something we tend to do. It's not very often, especially in a place like Western Loudoun County. But boy, are we ready to take care of these problems. So I got my buddy Lincoln right here. What a cool guy. Really nice hair. Cute kid. Right away when he smiled, I noticed this. His bite just looked a little bit off. Had to get a little bit closer up look to see what was really going on. Let's take a look at his profile. Another thing that I really noticed is his upper jaw and upper tooth position. If you remember from the previous episodes, you want to have your upper tooth position to be close in line with your forehead right here on this dot. So if we draw a line from his forehead straight down, you really don't quite see it. But yet, even when he's not smiling, take a look. His upper lip profile is actually really favorable. You really wouldn't have noticed anything wrong unless he actually smiled. Those are all key clues as to what I'm looking for long before I even put gloves on and do an exam. Okay, these are things I just look for when treatment gets going. When I took a look at his teeth, the first thing you may notice is his upper teeth fall behind his bottom teeth. This is what we call a crossbite, also known as an underbite. Okay, so ideally, where are these teeth supposed to go? Some people think the teeth are actually supposed to go edge to edge, like this, on top of each other. That's wrong. The upper teeth should actually fall a little bit of overlapping of the bottom teeth, as well as slightly overlapping horizontally. 2-3 millimeters this way, this is called overbite. 2-3 millimeters this way, this is called overjet. So in his case, we have a little bit of a negative overjet, and yet still a deep bite. When I actually did my tests on him, and I'm trying to see where he actually can close top and bottom, when I positioned his jaw correctly, he could actually go edge to edge. That was actually a positive sign for his case. This is very correctable at an early age. His upper arch, a little bit narrow. tad little bit of spacing. Nothing that I was terribly concerned about at this time. So what was my treatment plan for him? Simple. Combination of an expander appliance, face mask, and braces. The expander appliance, we've talked about this a lot. It will actually widen the upper jaw and not just the teeth. This face mask appliance, the upper jaw, once it's actually separated a little bit with the expander appliance, the jaw pieces are a little bit loose. You can actually pull the upper jaw forward by using a nighttime reverse pull headgear. I know at first it may look a little bit primitive, but I guarantee you, this is really still highly used, really great form of treatment at an early age to correct anterior crossbites or underbites at an early age, trying to maximize his chances to correct all these problems without jaw surgery down the line. On top of the expander, the face mask that'll be worn at night, recommended also a couple braces to line things up, close up his upper gap, make the teeth nice and straight so he has a nice healthy smile. As you can see right here, in just 5 months time frame, his anterior crossbite is a little edgy, and he was such a trooper. Every time I asked his mom, hey, how's he wearing the rubber bands? He put that thing on himself every single night, no problem at all. I think outside of like baseball tournaments and such, I'm like, I'll be very pragmatic here. He's out with friends, staying overnight with like at a hotel for baseball tournaments, and he's with his friends. I'd be like, hey, I think you can get away with not wearing it for like a night or two. But he was such a trooper. He put this thing on every single night right after dinner, all through the morning by himself. Parents didn't even have to help him. He was great. And this is where we were, just 5 months time frame. What you're looking at here is now suddenly he can actually bite edge to edge. So it's a little awkward for him in that time being, being able to eat and function. But his mother noticed the progress, I noticed the progress, and so did he. You can see in this picture here, in the same 5 months time frame, his upper arch form is just much more developed versus before. The arch form is wider. His lateral incisors erupted. I got some braces on there to line those things up, and this is where we're at. Started to derotate some of the bottom teeth as well, and he's holding up really nicely. So, just keep progressing, wear those elastics really well. We're going to keep moving along. 9 months time. Top is the beginning, 9 months right here. He has officially jumped the anterior crossbite. Had to get these pictures. I was thrilled when this happened. He really couldn't quite see the difference, but he really liked it. But anyways, I was thrilled to see this positive overjet. Remember, you want these upper teeth to stick out in front of the bottom teeth by a couple millimeters. So he has had around like 2 millimeters right now. So keep going a little bit longer. I think I had the face mask not that much longer. As you can see here, the archum just really nicely broadened, even overcorrected a little bit to leave a little bit of space just behind the lateral incisors. Because why? The permanent canines underneath these teeth are going to erupt and take those places, so it needs the maximum amount of space. At 14 months, we got the braces off. What a huge difference when we got these things off. And in his words, it looked really weird. So it took him some getting used to, but boy, he definitely didn't regret getting treatment. He was actually really quite wonderful to work with. I looked forward to seeing him every single time and made some really great progress. Look at these top teeth and how it just nicely overlaps the front. Gums are a little bit puffy, but not to worry, that's pretty normal. It will subside in a few months, in which I do have pictures of. To account for some of the possible relapse, I like to just put like a little wire retainer on these top front 4 teeth, just to hold them together while the canines kind of erupt, and then he wears his retainer at nighttime. But so far, so good. Just 14 months time frame. These pictures here, as you can see, his gum tissue a lot healthier. No relapse of his bite or anything. He's very happy and thrilled with the results. I love this. I love these pictures compared to before and after. Everything just fit really well. What a beautiful case here. This is great. Again, nice arch form. Just monitoring the teeth, the lower alignment, the slightest little details, guys. Tiniest little details just add up. You look at one tooth at a time, it's probably not going to seem much, but when you add up all the details together, it creates a really nice, beautiful smile. And this is just step 1 of his treatment. Look at his face progression from the beginning, edge to edge, to when he jumped the bite, to when the braces came off, to in the retainer checks. He's thrilled with these results, and you can tell his hair has also changed a little bit. So he's gonna look amazing when he gets to the baseball field. No braces, no expander, no nothing, just a retainer that he's gonna wear at nighttime. I think he's really, really gonna like it. Be so much more comfortable. If we take a look at his facial photos from like the beginning to the end, such a huge difference. Cute kid, cool hair, nice eyes, nice smile. He already had really, really good energy, and I think at the end of treatment, he was just like really, really thrilled to not have anything. So I think now he can just uh, enjoy the life without the braces for the time being until he's ready for the second part of his treatment in a few years. So we'll take our time with that one, let him enjoy some time without the braces. But when we address him in the part two of side of things, then we can really, really go after the what we call the top 10 features of an Excelsior smile. We'll be able to address those goals at a much older age. It's going to be quite wonderful. Let's take a nice closer up look of his smile. Looks great. Nice relationship of the front teeth. Bigger smile. Totally life-changing. What an awesome picture here. Again, remember, we're looking at the forehead to this tooth right here. Everything just looks so far behind. Now look at this one. Much, much closer with that upper tooth falling in line with his forehead. What a great shot. Beautiful. And that's him at the very, very end. What a great time. Again, he was just 8 years old, finished treatment a little after 9 years old. Absolutely great. Pretty normal phase one early treatment. Definitely want to address underbites like this at an early age. Once you get past like 10 and 11 for a face mask, the likelihood of those tend to like really, really drop for this kind of correction. Then we're looking at other means of getting the underbite corrected. It's much more difficult to correct at like 12, 13 years old than it is at an early age, like 8 and like 9 years old, or even as early as 7. But anyways, love these results. He did a great job, great hygiene, awesome to work with. Definitely look forward to watching him grow up through the years, and I will still continue to monitor, as you recall from our observation check episode. We're going to continue to monitor him every 6 months, monitor the eruption of his permanent teeth, make sure there's no impaction, make sure if there's any other treatment that's needed, or we have to time it with a certain growth window, especially as far as a underbite grower, which we are monitoring for him. We're ready to jump in and intervene. I look forward to seeing you guys soon. But hey, thank you guys very much for tuning in for another episode of Excelsior Orthodontics. I'll see you guys soon. Bye now.